Welcome to Sweet Life Beat Life. We hope this video helps.
You begin by confirming the needle driver is clean, aligned, and the ratchet is released. This prevents surprises. Place the instrument into the center of your palm with the jaws toward your little finger so the weight is balanced. Slide your index finger to support the hinge area while your thumb rests lightly on the shaft. This gives immediate control. Once positioned, curl your palms slightly to trap the handle. Make sure the jaws remain visible for quick repositioning. Now you rotate your wrist so the jaws point directly at the needle. This reduces lateral torque and improves accuracy. Reach forward, use your forefinger to steady the needle tip, and bring the jaws closed around the shaft roughly 1/3 from the tip. That placement minimizes bending. Once the needle is seated, advance your thumb to engage the ratchet gently. This locks the instrument without overcompressing. Keep your elbow relaxed and move the whole forearm for coarse position. To finish, fine-tune your palm grip so the driver is secure but not crushing the needle. You should feel stable leverage for suturing motions. When you need finer manipulation, transfer the instrument carefully from the palm into a fingered hold. Use a single smooth motion to avoid dropping the needle. If the needle slips or the ratchet jams, immediately release the ratchet, open the jaws, reseat the needle at the correct angle, and re-engage. This simple reset resolves most problems and preserves needle integrity.
Thanks for watching. Consider subscribing if we helped you.